All right, now on to our Health Watch, where we talk about all of the topics that are trending in the medical world. As always, we're joined by Dr. Syed Hussain from Trinity Health in New England, albeit remotely. Good morning, doctor. How are you today?
Morning, Tim. Greetings from Spain. I'm doing well.
And greetings from Spain. The wonders of the internet. All right, let's talk about the new risk of possibly some new cases of MPox this summer. We thought we were done with this. What do we need to know?
Yeah, the CDC is investigating a cluster, Tim, over the last month or so, about 13 cases. So the take-home message here for viewers is, if you are planning on traveling, attending gatherings and events over the course of the summer, and if you develop any kind of rash, it's important that you get checked out clinically as soon as possible. And if you do belong to a high-risk group, and you have not been vaccinated yet for MPox, then now is the time to get vaccinated. Or if you got just one shot out of the two-shot vaccine, then it's not too late to get the second shot now.
Saw reports, switching gears here, that a man, I believe up in Maine, died from the Powassan tick virus. We know that sort of thing is rare. So how do we sort of categorize the level of risk? And are there any extra special precautions we need to ward off that virus versus other tick-borne problems?
Yeah, I don't want to cause panic. It's the same common sense precautions that you need to take, especially now in the warmer months if you are looking at hiking or spending more time outdoors in terms of avoiding ticks. So that includes using an EPA-approved repellent, a tick repellent, making sure that you cover your skin, cover your arms, legs, in areas, and looking for areas where you do have a higher prevalence of ticks to ensure that you remain safe. And if you develop any symptoms such as a headache, fever, nausea, vomiting, other symptoms, then please see a healthcare provider as soon as possible.
Okay. Lastly, I know we've talked about this before, but we probably can't talk about it enough. Social media's impact on young people's mental health. It's gotten a lot of attention. The Surgeon General has even stepped in to talk about best steps and practices. Can you tell us what steps can parents take just to make sure their kids are striking that right balance, where you don't want them necessarily off the internet and off social media, but I'm not going to complain if they don't ever want to go on, but how do we sort of find that balance, doctor?
Yeah, this is a big topic, important topic that the Surgeon General is using to raise awareness, do more research. But the take-home message here is, given that our adolescents, our young population is also, this is the backdrop, by the way, of a youth mental crisis that's brewing in this country. So it's important that we have technology-free zones or times where you get to interact with your children without social media, without technology, so that you can actually have those person-to-person conversations. As you may know, Tim, there's a large number of folks now that are just glued to these smartphones or social media, and that does take away time, especially in this age group where they need to learn, interact, and it's important that we have those times set aside for human interaction.
Yeah, listen, and not even teens. My 5-year-old wanted to have screen time at dinner yesterday, but after we got him off, within 5 minutes, we were all having such a nice conversation and learning about his day at kindergarten. It was so nice to see. Doctor, thank you for taking the time to zoom in from Spain to give us some of your knowledge. We do appreciate it. And we'll see you in person next week.
Absolutely.
All right, Dr. Syed Hussain from Trinity Health of New England, thank you so much for your time.
Thank you.